largest measles outbreak Minnesota has seen in 30 years has sparked the discussion once again over the benefits and risks of vaccines. The number of cases has grown to 48 since April. Most involve unvaccinated Somali American children.
The anti-vaccine community has really targeted the Somalis, and so the low vaccine rates that we're seeing have been a result of that.
Joining us now to discuss, we welcome our medical contributor, Dr. Ali Kasraeian. So, we're talking about these vaccinations again. You know, we think it's a settled issue, and then you have an outbreak like this that pops up, this time in Minnesota, where they have this large Somali population that just doesn't get vaccinated.
Yeah, I mean, this is a very challenging issue where we see similar themes revisited periodically over time. We saw it in California last year. I mean, we've had this discussion multiple times on this show, so you can imagine in the medical environment that deals specifically with these issues, how frustrating it must be where you have a solution. One of the greatest wins in modern science and modern medicine, where you can prevent diseases that can be potentially fatal, and you have situations like this where you see the negative ramifications that if you're not vaccinated. Now, it's not always someone's fault that you're not vaccinated, but here's the premise of how vaccination works. Vaccination works on this idea of herd immunity, meaning that the majority of your environment, the majority of your community is vaccinated and is protected from the disease, so that if someone who's younger, older, not vaccinated, if they are not a significant amount of the population, and if it's rare, they are protected and the rest of the community is protected from these bugs. If you get in a situation like this where a lot of people are not immunized and they're not vaccinated and get a disease like this, then you kind of disrupt that balance that vaccination can be incredibly successful in preventing such outbursts. We've seen it all over the world. Sometimes in political scenarios, people begin to create these anti-vaccination movements, and you can see how quickly now with social media, how the medical community rallies to fight against the myths of the lack of safety of vaccinations and the potential associations with vaccines and other illnesses. You know, they talk about autism.
Yeah.
Big study, large studies over and over again have dispelled the myth of that one study many years ago in Lancet.
Tiny study
that showed an association, which that one study was actually later found to be erroneous, and it was discredited. But look at all the damages done over the many years since then.
Well, let's talk about measles in perspective, though, because a lot of this generation, we don't really know measles. That wasn't part of our generation. It was generations before us. So let's talk about measles
so you can have fevers, you can have coughs, things that are very common. And the problem is that you don't quite associate it with what it could be, because like you said, many people, many physicians have not seen the measles. So you have to be very mindful.
I saw them on the Brady Bunch. I would watch the repeats.
Marsha. That was chicken pox. That was the 80s.
No, I think it was measles. Didn't somebody get the measles? I don't know, maybe not.
But I'll tell you, one of the things that I would urge everyone, especially new parents, you know, because these are confusing times.
Yes, very.
You know, and no one wants to hurt their children. You know, and these you can look on the media, and for every scientific fact that is gospel, you can find a million other things on Google, which can dispel it. And blogs are very powerful, especially when they are geared for people who have very strong messages against medicine, a variety of different things. So
well, then you have this group too from another country that, you know, probably don't get vaccinations.
Absolutely.
Just because that's their, you know.
And honestly, the situation that they've been going through at this time, maybe that's not a top priority on their list to get vaccinated or access to it.
Exactly.
So be mindful. If you are concerned about vaccination here in, you know, in a community where you have access to health care, if you don't, try to make sure that you can get access to health care for your children, which governmental organizations, various different things, still have a lot of safety nets to make sure children are able to get health care and vaccinations. You know, the politics of that are well beyond the few minutes we have here to discuss this topic, but be mindful of that you should have a risk-benefits, detailed, personalized discussion of any concerns you have regarding vaccination, because most physicians have seen the benefits of vaccination through their generation, which to your point is because most of us have not seen many of the diseases we're speaking of because of the profound successes of vaccination.
Right. All right, well, something else we want to ask you about is a new warning about some of the most common painkillers that many people use. A new Canadian study looked at 400,000 people who took so-called NSAID or SAID pain relievers like ibuprofen, and it raised their heart attack risk. And that happened just a week after they started on this pain medicine. So we hear all kinds of things about different things like Tylenol will measure your stomach or liver up, and ibuprofen now is going to give you a heart attack, and la 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 la. So what do you?
This is very frightening. Let me tell you.
Yeah, what do you do here?
Like Ms. Lawless mentioned earlier, we have stock in these medications, and I'm a type of person when I'm hurting, if I don't have to be, I'm going to pop something legal to get out of pain.
Well, it's commonplace. This is just what you do.
Yes.
This is, you know, headache, you know, take something, whatever.
Should I be concerned?
So one thing to kind of put as a caveat to this, one, this is an observational study. Although it is probably the largest study, if not the largest study of its kind, which the researchers took previous studies, and including a 2015 FDA warning that people who make NSAIDs, the companies who make NSAIDs, which are non-steroidal anti-inflammatory medications.
Which is Advil and Motrin.
Yeah, so ibuprofen, Motrin, Vioxx, Celebrex, Naproxen, naproxen. These medications are basically anti-inflammatory type medications that people take, like you mentioned, headaches, pain relief, and
arthritis.
You know, we've discussed it in terms a few months ago.
They're just commonplace medicines we all go to when we need relief.
But is it something that the study is really saying if you take them on a daily basis or 3 times a day, or is it once a month?
So what this study did, looked at more, like you said, more than 400,000 people, and they analyzed specifically the association between heart attacks and the use of non-steroidal anti-inflammatories, or NSAIDs. And because it's an observational study, it wasn't like they took the 4 of us and they lumped the 2 of us into you guys go take NSAIDs for a period of time, you guys don't, let's see what happens, that's the greatest type of study you can do. Here they went back and kind of looked at history, and what they found was people that took NSAIDs, regardless of dose, for a week, had a significantly increased risk of a potential heart attack, 20 to 50%.
Wow, that is major.
Yeah. If you took higher doses of prescription strain dose, after about a month of time, those risks became even profoundly more significant. So the things that you have to take away from this, does this mean that if you go and take non-steroidal anti-inflammatory, you take an ibuprofen like you mentioned, if you hurt, you're now going to get a heart attack? No. This, again, was an observational study based on association. So you can't, this does not directly prove that NSAIDs cause heart attacks or strokes. And they did not look in their analysis in terms of confounding factors. Did these people smoke? Were they obese? Did they have other medical problems from that? So that's an important missing piece of this that is criticized. However, it does open our eyes to the fact that these medications may not be entirely safe. So do we really need to take them? So again, I know it seems like we always talk about going and talking to your physicians. It's an assessment of risk benefits. You know, taking an ibuprofen every once in a while is different than taking it for a month nonstop.
Once in a while.
Yeah. The other thing is, you mentioned Tylenol. So Tylenol works on a slightly different pathway, and it can affect your liver if you take more than a significant amount, which tends to be about 2,000 to 4,000 milligrams, closer to that 4,000 milligrams per day, which is a lot of Tylenol to take, right? Or acetaminophen. Sometimes acetaminophen and even some other medications can be mixed with medications that are the narcotic pain medications. So be mindful if you're taking something else for pain, that what the other medication is. Is it an NSAID? Is it the Tylenol? So that can take effect. With this, I would touch base with your physician. See if the pain that you're having really needs a medication like this. The other thing is what the risk benefits are for taking this on a basis. The other thing, and maybe a great way to open the door for getting your cardiovascular risk assessment, to see what your baseline is. People with lower risk is different than people that have a higher risk at a baseline. So that's one thing to think about. The other thing is, when people stop taking it, after about a month or so, those risks began to decline.
Okay.
You know,
so there is such thing as reversing it.
Yeah, and the greatest decline was day 30 to year 1, where the risk came down to about 11%, which is lower than the 20 to 50%.
Definitely.
Very interesting. Before you go,
yes,
got to mention all the smoke in the air from the West Mims fire, you know, making their way here, causing a lot of problems for people.
Yeah, so one of the things to be very, very mindful. So if you're someone with asthma, if you're someone with emphysema, if you have someone who's on oxygen, or someone who is prone to airborne allergies that they can affect your asthma, be very mindful. You could have significant challenges if you go out to a very, very smoky, very dense situation like we have here. So be careful about that, and don't put yourself in a situation without an inhaler, without a rescue measure in case you get into trouble. That's one thing. The other thing is, if you can stay out of places that are very, very smoke-ridden, if it's possible, try to do that so that you don't put yourself at risk from a respiratory standpoint, because you don't want to tax the system or exhaust yourself in a situation which is already taxing if the weather's
It's pretty
like this.
bad.
Yeah.
It's pretty bad. So, all right.
Thank you so much, Dr. Ali.
Thank you so much.
Thank you for joining us, Dr. Kasraeian. This medical contribution was furnished by Kasraeian Urology. You can hear more from Dr. Kasraeian on his weekend radio show, The Conversation, Saturdays on WOKV from 5 to 6. Up next, want to get away? We find out what to look for to get the best cruise deals and how to make your dollar stretch. Our expert is going to give us all the details coming up.
It is very difficult